occurs in about 25% of the patients following NMI and about 50% of the patients that have heart failure. When mitral regurgitation is developed, these patients all have a worse prognosis. Now, the pathophysiology of this, let me explain to you. This is an example of a patient who had an inferior wall MI. So you can see that there is an inferior wall myocardial infarction. As a consequence of that, there is a remodeling of the ventricle. And what happens here is that this posteromedial papillary muscle is apically displaced. And as it's apically displaced, it makes all of these cords to be really taut. And it makes a restriction, particularly of this posterior mitral valve leaflet, and differently to degenerative mitral valve disease, this jet of mitral regurgitation will go in the direction of the restricted leaflet. So let me show you this. There is an inferior wall motion. The papillary muscle is displaced. You can see these cords are taut. The posterior mitral valve is restricted. Interestingly, you see that there is a cord that goes to the middle of the anterior mitral valve leaflet and actually changes the morphology. This is called the seagull sign. If you can see a seagull here, good for you. This is how you do this in 3D echo. 3D echo, I always like to think about this. This is a sardonic laugh. So you can see that the leaflet is actually patching each other, but there is a portion here of the leaflet that is restricted where there is malcoaptation. So this is for you to remember functional MR in a patient with ischemic mitral regurgitation. And the morphology is that the mitral valve is dilated and flat. You can see that there is a display here of both papillary muscles because of the remodeling. And as a consequence, the coaptation of both leaflets is massively reduced. Let me show you now a case of a 72